Okay, we are doing our NG tube series. This is part 2 section, and this is Mr. Smith, our patient, and we are going to go back. I've done steps 1 through 5 as I demonstrated in the prior video, and we documented all of my assessment findings. I think I forgot to include that this was measured at 60 centimeters, the NG tube, and that the size of, that it was placed in his right near, and that it was the size of the tube was a 12-inch French catheter. So what we're gonna do now is this is going to be my suction, and again, hand hygiene, gloves, ID the patient, tell my patient what we're going to be doing, and I'm going to connect to suction to the NG tube, and this is going to be low wall intermittent, which is about 20 to 40. So now that we have connected this, I am going to be doing that, and I'm going to be checking my patient about every 4 hours and doing any sort of lavage. I will be instilling 30 milliliters of sterile water and drawing that out. If he needs any medications, I'm going to be doing any medications one at a time. And to do that, I would disconnect this, obviously, and I would be flushing in between with about 30 milliliters is standard practice. And we'd be disconnecting probably about 40-45 minutes, and make sure that the meds are absorbed before I'm placing him back to suction. So hopefully he's feeling better, and if he is, we are going to be DQing this, discontinuing this. So I would turn it off, and he's going to be in the upright position, and I would tell the patient to take a deep breath before removing this and hold his breath as I pull it out fairly quickly. So Mr. Smith, I'm going to be taking out your NG tube, and I want you to hold your breath, and I want you to take a deep breath and then hold it while I pull out the NG tube. So before I do that though, and what I forgot to say before I would actually get to this part is I want to instill 30 milliliters of air into the tube. So after doing that, I would discontinue it. I would first take out the tape, and again, pull out fast, have him breathe, discard. And then I would go ahead and document what I did, and again, the same thing, make sure that how he tolerated the procedure, the time, the date, and anything else that would be relevant that I discussed in the previous video. So after that, I would also, if we're going to send this patient home, I would provide him with any sort of teachings that he might need. And I would make sure that he is comfortable, ask him if he had any questions. I would remove my gloves, hand hygiene, provide for privacy, and leave the room. And that concludes part 2.